A 62-year-old female has a large defect in her right mandible. Check out the full workup and surgery today on the open reduction. Welcome to the Open Reduction, your channel covering all topics oral and maxillofacial surgery. I'm Dr. Tom Bolton, and today we are repairing a large defect in the right mandible. This patient is a 62-year-old female who has multiple dental implants and is missing teeth in the right posterior mandible. She is unable to eat on the right side, and it is affecting her quality of life. She had several cadaver bone grafts done at an outside facility, all of which were unsuccessful. She was told she is not a dental implant candidate because of the lack of bone. On exam, there is a steep drop-off distal to tooth number 28, the right mandibular bicuspid. The bone is at the level of the floor of the mouth, and there's no vestibule to speak of. I take a cone beam CT, and there is a large bony defect in the right posterior mandible. This is a 1.5 centimeter vertical defect, and there's very little bone width as well. We can see where the foramen exits the mandible. The inferior alveolar nerve is practically at the superior crest of the bone. She is definitely not an implant candidate currently. This patient tried wearing a partial denture, but it was very uncomfortable and she was unable to tolerate it. She also saw another provider who attempted onlay allografts, which were unsuccessful. She's very frustrated and feels like she's out of options. Thankfully, there is a solution for her. The most reliable, successful treatment to repair bony vertical and horizontal defects is an autogenous graft. And because of the size of this defect, I elected to proceed with an anterior iliac crest graft. This procedure involved removing a portion of her hip bone and transplanting it to the mandible. This treatment modality gives this patient the best opportunity for future dental implants. The downside is a separate surgical site, which carries its own potential complications. After discussing all risks, benefits, and alternatives, this patient elected to proceed with the hip graft. This procedure is performed in the hospital under general anesthesia. I took preoperative measurements of the defect, so I know the size of the hip graft I want to obtain. Once the patient is asleep and the sites are prepped, I start with the hip harvest. I make an incision and dissect to the anterior iliac crest. If you want a more detailed explanation as to how I harvested this hip graft, check out the previous video I just posted on the channel. I use saws and chisels to create the bone block I want. Here is the block corticocancellous graft. I then curette to collect additional cancellous bone. Finally, I close the site in layers. Now that I have the graft, I turn my attention to the oral cavity. I create a full thickness flap with vertical releases. I then score the underlying periosteum. Now that I have the access I need, I place the block graft along the mandible. I choose the best orientation for the block graft and then smooth the edges and round it utilizing a reduction burr. Once I am happy with the position and shape of the graft, I secure it using screws.
sure you break through everything.
I pre-drilled the holes and used screws that engage the cortex of the hip graft and of the mandible. The graft must be immobile, so I use 2 screws and confirm that it is rigid. The other key to success is a passive tissue drape and a watertight primary closure. I packed cancellous bone and closed the site primarily using Vicryl sutures. This procedure is outpatient, meaning the patient goes home the same day. I saw her back 2 weeks later, and here is the post-operative radiograph. I am thrilled with the results. The block graft is in a perfect position, and I've recreated the bone height and width. I will give this 6 months and then reevaluate for implant placement. Thanks so much for watching. Please click those like and subscribe buttons and check out the channel for additional oral surgery cases just like this one. Also, visit my website, theopenreduction.com, for your continuing education needs. I'm Dr. Tom Bolton. I'll catch you next time on the Open Reduction.